and welcome to an introduction of the world of endocrinology. My name is Dr. Sonieli Lugo Ruiz, and I am a pediatric endocrinologist from the Morris Children's Hospital in Orlando, Florida. This talk is meant to obtain the big picture of how endocrinology is important in all of our lives. As always, please contact me if you have any questions, any comments, or would like further literature for review regarding this talk. Endocrinology comes from the Greek word ormain, which can mean to arouse activity, to set in motion, or to spur on. As you can see in the picture to your left, hormones are capable of producing multiple responses in the body. Adrenaline, known as the one in charge of that fight or flight response, is able to help in emergencies by increasing metabolism, tightening muscles, and increasing sensitivity to pain. Oxytocin and all endorphins, on the other hand, are known as relaxing hormones or love hormones as they decrease metabolism and increase relaxation. In general, all hormones are chemicals secreted by one tissue that can produce an effect, either in that same tissue or in distant tissues as well. Thyroid hormone is a very good example of an array of physiologic responses, as this hormone is in charge of our metabolic demands. In adults, this means successfully focusing on multiple tasks, GI effects like diarrhea and constipation, menstrual cycle regulation, hair and skin changes, and weight changes. However, in children, especially during the first 3 years of life, thyroid hormone is important for central nervous system development as well as linear growth. And so if there is something I want you to remember from this lecture, is that in the world of pediatric endocrinology, precise function of hormone control is needed for children to grow. In other words, and for general pediatric board questions, if linear growth is affected first, this means that this is an endocrine issue. If weight is affected first, check for other exogenous causes like immune issues or GI disturbances before you think about endocrinology. During my training, my mentor, Dr. Irizarry, would often refer to endocrinology as an orchestra. She would say that the pituitary gland is the conductor, and the glands in the body are all instruments that should be playing the same song. Now, as we get older, the song would often change, but they will always be in sync. I often refer to patients that endocrinology is like making a phone call. And so we might order a lot of labs, but sometimes we need to understand who and when somebody's making a call, and then we also need to see if the other side picks up the phone. In here, I want you to picture endocrinology as you have mission control, which is the pituitary gland, and that will be sending a signal from the brain, and the response will be taken by the astronauts or the glands in space. As you can see, mission control, or the pituitary gland, has multiple functions, but this often begins prior to that mission in space in the hypothalamus. The hypothalamus responds to neurotransmitters, internal and external stimuli, and that begins a cascade sequence of events that either go to the anterior or the posterior pituitary gland. As you can see in the picture, from this point forward, the pituitary gland transmits signals that are specified for each tissue. As a method of control and feedback, the final glands or tissues secrete responses that signal back to the brain to communicate that we had a successful mission. Another general pediatric board question is that it's very important to understand both the anterior and the posterior pituitary gland hormones. A useful mnemonic is to think of Peppa the Pig and remember flat peg for your anterior pituitary gland hormones. These are FSH, LH, ACTH, TSH, prolactin, endorphins, and growth hormone. The posterior pituitary gland, located to your left of the picture, produces oxytocin, an antidiuretic hormone, also known as ADH or vasopressin. Just like everything else in the world, we always need feedback. And the body is exactly like that, working with negative and positive feedback. I will be providing examples for both feedbacks very shortly, but keep in mind that for endocrinology, negative feedback is the way that most hormone levels are controlled. And this is by producing an effector hormone, which limits its own secretion by suppressing the production of its stimulating central regulatory hormone. For you to picture the negative feedback, you can refer to the picture to your right. This is a general overview of how you have a gland A, which produces a hormone A that is released in the bloodstream. And this hormone A stimulates a second gland, which is going to be gland B. Gland B, when stimulated, produces hormone B. Hormone B is released again into the bloodstream and can reach a target organ, but it also carries the function of inhibiting the secretion of gland A, therefore finalizing the negative feedback system. To your left, we can use the example of the thyroid axis. And so the hypothalamic pituitary thyroid axis works as releasing the thyrotropin releasing hormone from the hypothalamus, which activates the thyroid stimulating hormone from the pituitary gland, also known as TSH. And TSH increases and also produces that the thyroid is stimulated by getting T3 and T4 in the bloodstream. Now, once you have those two levels outside, those increased levels will also signal the hypothalamus to stop secreting TSH. As a way of positive feedback, we can look at the process of delivery and think that estrogen is released from the ovaries and that induces oxytocin receptors on the uterus. Oxytocin, at the same time, it stimulates uterus to contract, and it also stimulates the placenta to make prostaglandins. Prostaglandins also continues a positive feedback by stimulating more contractions in the uterus and also by stimulating more oxytocin. The beauty of endocrinology is that although it can sometimes be seen as hormone induction and tissue effectors, it's actually linked to all of our organs. With this in mind, I will briefly explore other organs and their relationships with endocrinology. I strongly encourage that whatever your main interest is, you look for your organ of interest and you search for hormones related to it. Trust me, you will be surprised. For cardiology and nephrology, we have to understand that there are certain hormones produced by the heart, such as ANP and BNP, and they are in charge of sodium and intravascular volume. The kidney as well inhibits vasopressin, and it also counteracts sodium retaining effect of aldosterone. And so the adrenal glands also inhibit aldosterone, but you have to understand that conditions like adrenal insufficiency and DI are mostly linked to other organ systems. Continuing with ADH and aldosterone, we have a regulation of fluid and electrolyte balance that will be affected in certain cases of diabetes insipidus. At the same time, when we think about bone formation, we have to think also about our kidneys, which control calcium and phosphorus through PTH, FGF23, and vitamin D. When we talk about gastroenterology and endocrinology, we know that there's certain hormones that are produced, such as ghrelin, and I usually say, remember that we growl when we're hungry. Ghrelin is always going to be increased when we have increased appetite. And leptin is sometimes linked to obesity, which can lead to problems in intestinal motility. Now, we also have found that genetics can be associated to GI and endocrinology, as some cases of monogenic obesity can be due to POMC or POMC gene mutations, and more specifically to MCR4 mutations, which leads to obesity in children and also to problems in linear growth. Last but not least, whenever we talk about pancreatic function, we know that there's certain pancreatic tumors that can lead to problems in endocrinology and GI. And of course, we all know about diabetes mellitus and the exocrine and endocrine function of it. Last but not least, I want to talk a little bit about pulmonology and oncology, since we do see cases of diabetes related to cystic fibrosis, which is also known as CFRD. And we also know that patients that are under steroid, they can have episodes of hyperglycemia, diabetes, and problems with linear growth. For genetic predispositions to certain cancers, we have found that certain conditions like MEN2A, MEN2B mostly, can be linked to all endocrine, oncology, and pulmonology. And with this, we have just finished our introduction to endocrinology. So I want to thank you for joining me in this journey, and I will try my best to further give more lectures related to these topics. I want to also take a moment to thank my mentors from my Pediatric Endocrinology Fellowship at Children's Memorial Hermann Hospital in Houston, Texas. And I also want to thank my colleagues and staff at Nemours Children's Hospital in Orlando, Florida, who always encouraged me to continue in this pathway of learning. This talk was last updated in November of 2019, and I'm very open to any suggestions and comments. Thank you.